In this video, I'm going to explain cavernous sinus. Cavernous sinus is known for its superficial resemblance with the corpora cavernosa. That's why it's called the cavernous sinus. We classically learned cavernous sinus as a big space of venous plexus, or a big space of veins, right? However, it's not just a space, it's not particularly a sinus, but it's filled from the inside by multiple venous plexuses. And it varies a lot between an individual to another. What we need to learn about cavernous sinus is basically three things. What's the inflow, what's the outflow, and what are the contents of the cavernous sinus. The inflow usually get flow from the superior ophthalmic vein and also the inferior ophthalmic vein and the pterygoid plexus, the sphenoparietal sinus. The outflow will usually go into the superior and the inferior petrosal sinus. Consequently, this will go into the sigmoid sinus. So the contents of the cavernous sinus can be divided into two things. Contents inside the wall of the cavernous sinus, and the content inside the substance of the cavernous sinus itself. So starting by the wall, you will have four nerves: the oculomotor nerve, trochlear nerve, ophthalmic and maxillary divisions of the trigeminal nerve. And as you can see, the maxillary nerve is the only branch that doesn't go through superior orbital fascia. The oculomotor nerve, trochlear nerve, ophthalmic division, all of them will go through the superior orbital fascia. And the maxillary nerve will only go through the foramen rotundum. So these are the contents in the wall of the cavernous sinus. Into the substance of the cavernous sinus, you will have the internal carotid artery and also abducens nerve. The abducens nerve is not related to the dural wall of the sinus inside the substance of that cavernous sinus. So to summarize, cavernous sinus is known by that name because of its resemblance of the cavernosa, corpora cavernosa. It's not particularly a sinus, but it's full of venous plexus from the inside. And to study the cavernous sinus, we need to know three things. What is the inflow? What is the outflow? And what are the contents? Talked about the inflow as the superior ophthalmic vein, inferior ophthalmic vein, and the sphenoparietal sinus. The outflow will be the superior petrosal sinus, and also the basilar plexus, the pterygoid plexus, and also the intercommunicants between the two sinuses. The contents should be classified into contents related to the wall and contents related to the substance of the sinus. Inside the substance of the sinus, you have the sixth nerve and the internal carotid artery. And in the wall, you have oculomotor nerve, which is the third, the trochlear nerve, which is the fourth, and you have 5-1 and 5-2, right? 1 is the ophthalmic and 2 is the maxillary. And as we mentioned earlier, first 3 will go through the superior orbital fascia and the maxillary will go through the foramen rotundum.